Leon, thanks for that live report. With COVID-19 cases starting to level off in some Western Mass communities, could we be moving past the worst of the Omicron variant?
Western Mass News reporter Matt Satilli has more after bringing those questions to local doctors and health officials. Matt?
Chris and Jordan, for the first time in over 2 months, weekly COVID cases are decreasing in the city of Springfield. I checked in with the city's top health official and doctors from Baystate to find out if this trend can continue.
People mention a peak in the winter. I always think you've climbed up a big hill and now you get to go sledding down it and it's smooth sailing. And I would look at it a little differently.
After Dr. Anthony Fauci announced the Omicron variant of COVID-19 could reach a peak by mid-February, we took questions to Dr. Jacob Smith, an infectious disease physician at Baystate Medical Center, to find out if the same applies here in Western Mass.
The numbers are quite high, and they remain quite high. So it's, we're past the longest night of the year, but the nights are still long.
In Springfield, weekly case counts are down for the first time since mid-November. For the week of January 16th, the city saw more than 400 fewer cases than the week prior. But Helen Calton-Harris, the city's Health and Human Services Commissioner, tells us people should not let their guard down.
It's important that we're leveling off, but I do not want our residents to get complacent because we're not in a position where we can let our guard down.
As for other COVID prevention measures, including at-home test kits,
people are picking up the test kits, they are using them, and we are grateful for that.
At Baystate, Dr. Smith tells Western Mass News hospital beds are still packed, but he adds hospitalizations tend to lag behind infection rates.
I'm trying to make it clear that these things are not good right now, but I'm hopeful that things will get better going forward as we move in closer to the spring.
And we also wanted to know what the future of the pandemic could look like.
I would hope that going forward over time, COVID will become something more manageable. But when I say over time, I don't know if that's over 6 months or 6 years.
Dr. Smith also tells me he's optimistic that authorized medication is becoming increasingly available to help treat COVID. Coming up later at 6, we'll have more on how COVID could affect your taxes if you've had to miss time off from work due to the virus. For now, live in Springfield, Matt Satilli, Western Mass News.